Okay, so we're going to do modified Robert Jones. We can use this for covering wounds. We can also incorporate splints into them as well. We're going to pretend that she has a wound here. So if there's an open wound, we want to make sure that we don't contaminate it more. So we're going to put on gloves. And then we're going to apply sterile lubricant to the wound. So you apply that onto the wound area first before you clip, so then you can clip around the wound. That way, if any fur gets onto the wound area, it's stuck to the lube, and then we can flush it off with some sterile saline. We can clean our wound with our antiseptic. After we have done all of that, we can apply our primary layer, which is going to be a Talpa pad. And with that, we're going to put our ointment onto the Talpa pad. This is silver sulfadiazine. We might also use something like honey. That's actually great for wounds. So we put our primary layer on our wound, and then we're going to apply the stirrups to the leg. And the stirrups are going to be with the white tape. You do not want to put stirrups over the wound. Usually we're putting them on the lateral and medial aspect of the limb. If the wound is in that area, we can apply them to the palmar and dorsal aspects of the limb. So we have the stirrups, and to keep the stirrups from getting stuck to each other, we can put a tongue depressor in between. And this one is already stuck to itself. All right, and then next we're going to apply the secondary layer, which is going to be cast padding. The cast padding is there to help absorb any exudate. We want to start distally in our small animal bandages, and we want to try and leave the middle two toes, so digits 3 and 4, exposed. We can check those for any swelling as it's been a day or two since the bandage has been on. So if a bandage is too tight, we can start to see those toenails spread apart. So we want to make sure that they're stuck together or close together, and we always have the owners check that. Then we're going to do 50-50 coverage with the cast padding. With the cast padding, you can't go too tight with it, so you can pull a little bit on it. If you pull too hard, it's going to tear. So this is going to be we're going to go all the way up to the joint, or the elbow joint, a little bit above it, so that it's holding. We don't want a bunch of wrinkles in our bandage, so if we start to see a wrinkle, we can try and adjust. Okay. And then we can cut or we can tear. And then next is going to be our tertiary layer. So the rolled gauze is going to be the first part of the tertiary layer. We don't want the tertiary layer to touch the skin at all, so we're going to leave a little margin of the cast padding showing. We're not going to pull tight on the tertiary layer. It's just firm enough that we're not going to have the bandage slipping, but we can still fit a finger comfortably under the bandage. We know it's not too tight. And again, 50-50 coverage. I'm going to keep wrinkles out of the bandage. Those wrinkles can irritate the skin underneath and can actually cause wounds. So we do want to make sure we are keeping the bandage as flat as possible. And then at the top of the bandage, we're also leaving that secondary layer exposed. And we're going to cut the rolled gauze because that will not tear. Now we're going to reflect our stirrups back, and we're just reflecting them. We're not pulling on them. If you pull, you're going to end up pulling the skin and fur underneath the bandage. So I just twisted, and I'm taping it onto the rolled gauze. And again, there's no pull laying it flat. Next is going to be the vet wrap. For the vet wrap, you can unroll it completely and then re-roll it because it does stick to itself a bit. The other way to save a little bit of time, if you have a time constraint, is to unroll it while you're making the bandage. So again, we're going to follow the rolled gauze. We're not going to allow the vet wrap to touch the skin. And we're not pulling on the vet wrap at all. There is no tension on this bandage. This will tighten up a lot and cause a lot of irritation to both the skin if it's touching the skin, but as well as to preventing appropriate blood and lymph flow within the limb. And we're gonna do 50-50 coverage. Once we've run out of vet wrap that we've already unrolled, we can hold the bandage in place, unroll enough to go around. So see, as I'm unrolling it, it stretches, and then I relax it, and then I'm just placing it around. There is no tension on this layer of the bandage. I'm going to hold every time I'm loosening, and then lay flat. And again, I'm not going to allow it to touch the skin, but I am going up over the elbow. And then this last bit, I can cut. And lay flat. And then I can use elasticon at the top of the bandage. So this is stretchy as well. We want to make sure when we lay it, we're just laying it flat, and that line is demarcating how much is going to be over the bandage, how much over the skin. So I'll usually cut it before I place it on the patient, and I just relax it as I place it around the limb. We can also put it at the bottom of the bandage. We can leave the toes sticking out, but then we have some non-slip tape at the bottom to help protect the bandage. And then we would cut that, and that's our modified Robert Jones.